Hi friends, welcome back to the Cancer Awareness Initiative of MedicoExperts. The intent behind this video is to know the rightful information on pancreatic cancer regarding its symptoms, its causes, its risk factors, its conventional line of treatment, and majorly the new advancements in pancreatic cancer. Before moving ahead, I'd like to introduce myself. I am Dr. Ashita from MedicoExperts, here to tell you the best advancements and give you the rightful information regarding pancreatic cancer. So let's move ahead. Firstly, let's talk about pancreatic cancer. Pancreatic cancer is known to be the most fast-spreading cancers of the body. It is one of the cancer which has around 25 to 30% of survival rate only. And the lowest survival rate is because of the late detection of pancreatic cancer. So let's first talk about the signs and symptoms of pancreatic cancer. So the first major sign that we see in pancreatic cancer is the sudden onset of jaundice. That's the yellow pigmentation of the eyes, of the skin, then itching of the skin. There is change in the bowel movements, change in the stools, change in urine, blood clots in urination. A sudden onset of diabetes should be a warning sign for pancreatic cancer, as we all know that the pancreas would be involved and it would shoot up the insulin level. So these are some of the alarming symptoms that we should be aware. Now let's understand who are at the risk. Now there are no certain positive factors of pancreatic cancer, but surely there might be some people who are at risk of pancreatic cancer. We should be well aware of what are the factors who contribute in pancreatic cancer. So talking about them, smoking, alcoholism are the basic factors which can contribute for pancreatic cancers. Other than that, any family history of chronic pancreatitis, any history of pancreatitis, any history of diabetes or family history of diabetes or any genetic disorder should be some of the risk factors that can involve pancreatitis. So if you have any of this as your risk factor, do keep your check-ons going on routinely. Now the next factors that we need to talk about are the diagnosis. Before getting treatment for any kind of disease, it is very essential to have the rightful diagnosis of the treatment. So firstly, talking of the diagnosis, the endoscopic ultrasonography is one of the tests which is performed as a diagnostic to pancreatic cancer. PET scan could be the other one which is very important along with the biopsy report, without which we cannot start the treatment. Now there are certain biomarkers which are very important for specific organs. For specific organ of pancreas, the biomarker of Ca 19.9 is very important. If it is high, then surely you must consider getting a PET scan and a biopsy done. Now let's understand the different stages of pancreatic cancer along with the different treatment lines which align with the stages of pancreatic cancer. Now stage 1. Stage 1 is more or less of the localized cancer. It can be either to the head of the pancreas or the tail of the pancreas. Now this is the stage wherein your survival rate becomes the maximum. So friends, we do recommend you to go to a surgeon who has performed highest number of pancreatic oncological cancer surgeries so that you have the best possible survival rate. Now stage 2 is somewhere the localized part along with some lymph node is being involved. This may be borderline resectable, this may be surgically removed. Along with that, there might need some chemo or radiation therapy, a combination. Stage 3 is where the metastasis has spread to other organs. These are mainly the non-resectable cancers and where the chemotherapy, targeted therapy, immunotherapy and radiation therapy might come into picture. Stage 4, which is also known as the palliative care treatment, wherein the metastasis has vaguely spread to a lot of organs and it is very difficult to control the metastasis. This is more of a palliative treatment wherein we are trying to settle the symptoms of the patient to give him a better life and increase the good quality of life. Chemotherapy is mainly used in such kind of cancer as a traditional route or method of practice. These are more or less the conventional line of treatment which is mostly used in most of the times. Although today we are going to talk about some of the advancements which has happened into pancreatic cancer surgeries. The main new advancement into pancreatic cancer that all are talking about is the Whipple surgery. Whipple surgery is the most practiced surgery for pancreatic cancers, wherein it increases 60 to 70% of survival rate, which is a lot, I would say. Now, this can be done only if the pancreatic cancer is detected at an early stage, wherein the head of the pancreas is involved and there is no metastasis of the cancer. Now, here exactly what is done is the part of the head of the pancreas is removed and rejoined along with the pancreatic vein and the bile duct. Altogether, it is a very successful, you can say, surgery which can increase your survival rate, although it has its own limitation. It can be done only in cases where there is early detection of the cancer. That is, if you are in stage 1 and probably in stage 2. Although, as we have already discussed, pancreatic cancer has one of the most vague symptoms and it is very difficult to be detected in the earliest stage. And that is the reason many people pass away the first stage wherein the Whipple surgery can take place. Now, takeaway from this video are the preventive methods, or if you or your loved one is suffering from pancreatic cancer, what are the things that you should look after? As a preventive method for any kind of recurrence or any kind of regular checkup that you need to go through, that is every 3 months of checkup for your blood investigations, that is CA biomarker 19.9. Do not forget to get the PET scan done every 6 months for next 2 years and after a year for next 5 years. If there is any kind of early symptoms that are observed, be cautious. Now, this was all that one needs to know about pancreatic cancer. I hope this information has been useful for you to understand the basic overview on pancreatic cancer and the new advancement into it as well. If you further need any kind of information or guidance to get the rightful treatment for you or your loved ones for pancreatic cancer, you can get in touch with us on the below given number. Here on, I sign off for this very session, but remember, I'll be coming up with a next session of cancer awareness videos. If you're looking forward for any specific topic, do let me know in the comment section so that I'll make it for you. Thank you, friends, and see you soon. Here now, Dr. Ashita signing off for today.